Teresa.
Hi, I'm Dr. Saffi Biasetti, and I am a somatic psychotherapist here in Saratoga Springs, New York. I am also a mindfulness teacher and a self-compassion teacher and trainer, an embodiment teacher and trainer, a certified yoga therapist, and an author. I'm here to speak with you today about self-compassion during these times that we are going through now, this time of crisis with COVID-19, and how the practice of self-compassion and understanding what self-compassion is can really help us through times such as this. Before I begin, I want to just inform you a bit about self-compassion and what that is really about, because I think there's a lot of misconceptions about it. So self-compassion, according to the foremost researcher on it, Kristen Neff, is made up of three components. Now, the first component is self-kindness, or what we call being a friend toward oneself. And the simplest way to really tap into the understanding about that is through the question of, do you treat yourself the same when you're going through a difficult moment? Do you treat yourself the same way that you would toward a friend of yours going through the same difficult moment? So it's a question that brings us right to the immediate awareness of how self-compassionate or how self-kind we usually are. It's a lot easier, we find, to be kind toward somebody else than often to be kind toward ourselves, especially when we're having a difficult time. So that's one area of self-compassion. The other area is mindfulness. And mindfulness is being aware in the moment of what we are experiencing in feeling, in thought, in bodily sensation, and being able to be present to that without judgment or without criticism. Basically, it's the being able to be with what is in the very present moment and purposely and gently calling our attention to that. And the third component of self-compassion is common humanity. And I really think there's no greater time to talk about this component, because this is exactly what we're in now. Common humanity is the recognition that we are not suffering alone, that there are other people suffering along with us, and that we all have a wish to try and help and heal and alleviate the suffering right now of others. And in these unprecedented times, common humanity is what we're calling on the most right now, aren't we? There's never been a time in the world that every single person is being asked to do the same thing, and not just for our own health and safety, but really for the health and safety of one another, right? So it's really tapping into and deeply calling upon this component of self-compassion, this common humanity that says, my health is your health is my health, and that we're all in this together and we all have a role and a part to play. And it's also calling upon ourselves to really recognize how we may feel deep inside the wish and the desire to help, right? I've heard that from so many people, and it's a beautiful thing to tap into, right? And what you're really tapping into is common humanity at that point when you say, I want to do something, I want to help in some way. What you're really tapping into is the wish and desire to alleviate another's suffering. So these are all the components of self-compassion, and they're so very important at this time. As I said, the common humanity is first and foremost right now, but then comes the mindfulness and the self-kindness component as well. That is huge at this point, and where it's really huge is in noticing exactly what you are experiencing in this moment and being accepting of that, And what I mean by that is I have heard such a full range. I have heard folks say to me, "Well, Dr. Ann, I'm doing perfectly fine. I really don't feel much at all. I'm an introvert anyway, so I like socially isolating. So I'm really doing okay." And then I've heard folks saying, "I'm not doing okay at all. I know someone who is sick, or I got sick, or something like that, or I'm just really struggling." And so there's these two extremes happening here. And either one is okay. However, what I often say to the folks who say, "Oh, I'm doing perfectly fine, it's really okay," is I really like to ask the question, "Are you sure about that?" And the reason being is because, again, collectively, there is a huge amount of suffering and anxiety happening around us, right? So even if we're not attuned to that in the most obvious way, what I'm asking everyone to do during this time is to really start attuning to all the subtle areas, and all the subtle cues that may be happening both through your body or through thoughts that may be moving around a lot, perhaps ruminating around. Be aware of all these subtle cues, because sometimes the distress doesn't show up in just the most obvious ways, right? And this is a time also, often I've heard people say or dismiss their feelings because it's not as bad as somebody else, right? So, of course, we're hearing all the enormous, enormous suffering of those who have been afflicted with this themselves, or a loved one has it, or somebody has passed away from it, really traumatic events. But please know that you're allowed to feel whatever you're feeling around this, even if you or a loved one or someone you know has not been touched in a traumatic way. You're allowed to feel the loss and the grief and the heaviness of the world, and not have to dismiss that because it hasn't been your direct experience. So I think it's very important. The self compassion opens up the door to allow us to really accept in the moment. Here's that mindfulness component again, in the moment, what we're experiencing without rationalizing it away, or without saying, "Well, it could be worse," or "I'm still going to be grateful for this," or, "I'm just going to direct my attention and focus to only joyous things." All that is wonderful and really wonderful practice. And I don't want to discount any of that, because we need all of that during this moment too. However, I really want to make space for you being allowed and you allowing yourself to experience and feel whatever that may be at this time, because that matters too, right? So, our wish and desire to reach out to another, what I ask people to do is first tap in to yourself. Notice what you're experiencing around all of this. See if you can soften and soothe that. And then let's reach out to help another. That is how we really begin to practice from the heart, right? And give from the heart. So, I'd like to guide you through a little practice, a little self compassion practice that'll have all of these components to it. And I'm hoping it will be helpful to you to help you notice and discover what you're experiencing in this time, and hopefully find a way also to help you move through it. Okay, so I'd like you to take a comfortable seat, sitting in a chair preferably, and this way you can ground your feet. And in this moment, you can gently close your eyes. If you feel uncomfortable with your eyes closed, that's fine. You can keep them open to a soft, fixed gaze. But either way, let the eyes just gently soften, and take a deep breath in through your nose and out through your mouth. And now I'd like you to direct your attention down to your feet. and the grounding of your feet. And as you ground through your feet, feeling the lower half of your body very present, just follow the sensation up through your back body now, up through the length of your spine to the crown of your head. Maybe feel how your spine lengthens there. And then feel the connection of your grounded seat to the support beneath you. So just noticing the presence of your body right here, right now. And as you notice this presence, this is a great time to start to direct your attention inward to any areas of your body that may have been subtly or very directly holding a lot of this anxiety, tension, stress, distress. Perhaps even not in your awareness, or that hasn't been in your awareness up until this point. So just see if you notice now where your attention is drawn to, what areas of your body may be calling you more than others. And so let's say it's in your back body here that you feel some unpleasant sensation or some tension. Just want you to very gently move through your back body. So maybe that's just folding over a little bit or sitting up a little taller. Maybe you notice the tension living in the area of your neck. So then just very slowly move your head side to side so that we're just calling attention. This is like saying to these areas of your body right now, I see you and I feel you. So you're directing attention. So here's that embodied mindfulness component right now. I feel you and I see you and I acknowledge you. So just noticing the areas where there may have been this holding or where there still is this holding. Now with your next breath, I'd like you to take one hand to your chest area and one hand to your belly. So one hand to the chest, one hand to the belly. And here I want you to just witness where you can feel your breath moving from. So as you inhale, can you feel your breath moving the hand at your belly more, or the hand at the area of your chest? So just notice that. Just notice where the breath is beginning here. More in that upper half of your body or the lower half. Just this simple awareness. And if you really feel the breath coming from the area of your chest, I would like you to see if you can envision allowing that breath to travel downward, giving it the permission to move from that area of your chest all the way down into the belly, so that it slowly begins to move downward into this natural rhythm from the lower center of your body. The breath starts to slow. It starts to move down and away from the area of the throat and the chest and down into the belly. And just noticing that. Notice how you can soften your own breath. Now I'd like you to place both hands, the area of your chest, the area of your heart space, And now let the hands move in gentle circles around that space of the heart. Gentle circles here. And I'd like you to just connect with the sensation of the hands gently circling around that space of the heart, one hand on top of the other. Gentle pressure, maybe the temperature of your hands. Maybe there's coolness there that they've brought to that space, or maybe there's some warmth just circling around. And now stilling, just feeling that connection to your own heart space. I'd like you to hear the words. I allow and deserve to feel whatever it is I may be feeling right in this very moment. Whether I've dismissed these feelings as too small or insignificant, I will allow them just as much attention now as I would something large or intense. May I attend to and pay attention to all the subtle ways that my body, my mind, and my heart have been feeling, not just the large ways. I deserve the attention to feel. I deserve the permission to feel whatever it is I may be feeling in this very moment. May I allow myself this space to become aware, to acknowledge, and to let myself feel all that I am feeling, and to offer myself the gift of compassionately seeing that and softening that in this very moment. Take a deep breath here. Exhale. Now I'd like you to keep one hand to your heart and open the other hand out, palm up. And this hand representative now of the common humanity once again. And now hearing the words, may I be safe and protected. May I find my way back to health and strength. May I allow myself to feel whatever it is I may be feeling that is causing any level of distress or suffering. And may I learn to live in peace and ease. May all beings be safe and protected. May all beings find their way back to health and strength. May all beings allow themselves, on whatever level, to acknowledge and feel their suffering. May we all acknowledge that we are connected in a collective suffering in this very moment. May we learn from this to live in peace and ease with one another. May we all learn from this to continue to care for and wish to alleviate not just our own suffering, but the suffering of another. Take a deep breath in, exhale. Slowly release both of your hands. Come back to focus on the grounding beneath you. Feel your body present in the room once again. A softened breath. And then, as you're ready, slowly come back to open your eyes. So I hope that this little practice has offered you a moment of coming in and toward yourself, as well as connecting you with others and toward others. And I hope that you can use this at any time that you need the reminder of just a little more self-kindness and really being okay with that. Because in the end, my friends, we're all just trying to be okay, right? So I thank you and send you off with the wish of staying safe and healthy. And you can find more of my work on my website at www.anembodiedlife.com. And there you can sign up for my monthly newsletter where I continue to offer you some teachings and practices, embodied practices each month I offer. There's also on my website a page of free resources where I have many meditations that I've recorded for free and podcasts that I've done and articles that I've written. So please browse through that and check it out. You can also take a look at my book, which was released in 2018 through Shambhala Publications. It's called Befriending Your Body, a Self-Compassionate Approach to Freeing Yourself from Disordered Eating. And if you're local, you can find me in my office at 3 Franklin Square in Saratoga Springs. And I also teach classes at Yoga Mandali, the yoga studio downtown. And there I also offer my therapeutic restorative yoga training programs as well. Lovely to be with you all. Namaste.